The gateway to the West, Cardinal Nation, St. Louis, Missouri, is the home to some of the most brilliant physicians in the world. These doctors are pushing science to its limits, healing patients in new, innovative ways, and doing it at the same time they are teaching the next generation of doctors how to save lives. Meet Dr. Christopher Barrios, a specialist in pulmonary disease and the Associate Director of the SLUCare Adult Cystic Fibrosis Program, and Dr. Ravi Nayak, Interim Chair of Internal Medicine, Division Director of Pulmonary and Critical Care, and a medical advisor to the Gateway Chapter of Cystic Fibrosis Foundation. This is the science of healing.
I don't remember it. My parents said when I came home from the hospital, I just wasn't digesting any food. I wasn't going to the restroom, anything that is natural for a newborn.
You know, I wasn't thriving. I wasn't hitting all the milestones that you would normally see an infant hit. I kept going to the pediatrician. Pediatrician's looking at me going, I don't know what's wrong with him. You know, he's got the book of diseases open.
I was diagnosed right at 1 year old, and they told mom and dad I'd be lucky to get out of kindergarten. There were no adults, and mom and dad remember seeing one teenager.
I was diagnosed in 1990 at the age of 2, and at that time my parents were told, don't expect her to live past high school.
You finally run into the right person who says, hey, you know, we should do a sweat test for cystic fibrosis. And obviously they do the test and my salt content is off the charts. So yes, of course he has cystic fibrosis.
Cystic fibrosis is a genetic disease that results from a mutation in a gene called CFTR.
And what that means is that two parents have a copy of a certain mutation, and that the child gets both copies, they have this disease. Fundamentally what the disease is, it's characterized by the inability to transport salt effectively, and because of that, patients end up with thick secretions in various organs in their body. And how this presents clinically is going to be symptoms of cough and lung disease, inability to gain weight because their pancreas doesn't help work well, so they can't absorb nutrients.
It can also result in infertility. It can result in liver disease and intestinal obstruction.
The 85% of the deaths happen in cystic fibrosis is due to lung disease, and 15% of the times they die due to other causes. The patients have a difficulty clearing the secretions in the lung, and when you cannot clear the secretions, bacteria get trapped in the lungs. It leads to destruction of the lung tissue, what we call bronchiectasis. Bronchiectasis means dilatation of lung tubings. So the main problem in cystic fibrosis is for the patient to clear the secretions.
Life expectancy right now, mid-40s. My whole life I've been affected by that life expectancy. You know, when you discover at 15 years old your life expectancy is now 18, that's spooky. So I wanted to do more with my life, and I did. I've done a lot of great stuff. Last time I was younger than my life expectancy, I was 30. Sometimes it feels like you're living on borrowed time.
When I started treating Michael, he was 35-year-old. Life expectancy at that time was 39 years. Now Michael is almost 51-year-old. I'm embarrassed to say this. Michael actually motivates me to exercise regularly now. Okay, so Michael is trying to maintain my health. I'm very proud of Michael's health. He's a productive citizen, and he motivates a lot of patients with cystic fibrosis.
I had a little time of struggle when I really discovered CF as a teenager. Like, what does this really mean? I thought, well, I want to live. I wrote a book about living with a chronic illness and really how to live fully. And then that led to speaking, and then that led to coaching. CF used to push me in not good ways, and then I allowed it at some point to more pull me in positive ways. instead of always worrying about life expectancies. And I thought, well, what can I do with it? And that's when I started running marathons. Like, I just thought it was cool. Like, I have cystic fibrosis. I'm not really supposed to be here. What if I ran 26.2 miles without stopping? How cool would that be? I'll show CF, what's what. And so I started running crazy. I've run 9 full marathons and 20 halves. And at one point, I was one of the oldest CF patients and the most healthy.
Cystic fibrosis patients are heavily dependent on a caring and a compassionate physician who is an advocate for them. I have to share with you from my heart, we become friends for life with our patients. And that's kind of the relationship is very important. They are completely dependent on the doctors for guiding them in the right direction. We talk to them about their lung health, their gastrointestinal health, their reproductive health, and when they want to get married and want to have children, we guide them properly.
To get beyond a clinical relationship is really important. I see him 4 times a year when I'm healthy. More if I get sick or have to go to the hospital. And I don't know what it would be like to have someone that maybe didn't care for me personally.
There is a new concept in cystic fibrosis. It's called co-management. Co-management means you involve your patients as partners in their own health care. So cystic fibrosis has at the forefront of this co-management. Many other disease foundations like type 1 diabetes, sarcoidosis, they would like to follow the model of Cystic Fibrosis Foundation.
I think we have a partnership in health because there's an exchange. If there's bad news to be given, he has permission to give that because we have relationship. I know he cares about me greatly. When my father passed away a few years ago, he and I had just such an amazing discussion because he and his father are best friends. So he understood what I was going through, and we had such a deep personal conversation that's with a doctor, my doc. And I remember a while ago, years ago, I was training for an Ironman triathlon, and one of the local papers picked up the story and full feature in the health section. And when I went in for my next visit, he had that article and he asked me to sign it for him. And I thought, this is not normal, right? This is not a normal doctor-patient relationship. He's in with me. I know he wants the very best for me.
Michael and I are personal friends. He motivates me to exercise regularly, and he and I cycle together.
We had to figure each other out, right? It's like literally it's like a marriage. I speak to him about the most intimate things with my body. He tells me the toughest things that you have to tell a person. And we had to figure each other out. And once we did, just this relationship blossomed, and I had absolute trust in him, and he had permission to tell me good and bad, and I had permission to challenge him on his own health.
Chelsea is one of I think, our model patients. So she is someone who's very, very put together. She comes into clinic with notes always for me and says, okay, I have my notes, and she asks lots of questions, good questions.
When you have cystic fibrosis, there are so many, really every system in your body is affected by that genetic mutation. There's a team of people. You have, kind of a primary doctor, but a dietitian, you have a gastroenterologist. You have all of these doctors. And what's kind of wonderful about that is you have a team of people who are experts in whatever you might have a question about.
Multidisciplinary care. So doctor is just one part of the team, and I have to rely as a CF doctor on my dietitian, social worker, nurse coordinator, respiratory therapist, and physical therapist.
We have this team approach because people with CF do have so many needs. They're on so many medications, and these are very specialized medications, very expensive medications, and so they may need help with cost of the medication. We also want to make sure that they see a dietitian frequently because body mass index, their weight, is very closely tied to their lung function. They also are responsible for doing a lot of respiratory therapies, and they may have questions regarding, cleaning of the nebulizer. So it's a multifaceted, multidisciplinary approach to their care.
They really want their CF patients to thrive and not only be healthy, but lead a full life. I mean, it's so neat how the entire team celebrates. Oh my gosh, this is your new hobby, that's wonderful.
As per the Cystic Fibrosis Foundation guidelines, we have to see the patients 4 times a year. We have a dedicated cystic fibrosis clinic on Monday mornings. Thursday, prior to that particular Monday, we go through the list of patients and we go through all the standard requirements for each patient. If the patient has not had particular test, we make sure that patient gets the test on the day of their visit.
It's amazing. It's almost like you're working with a big family.
I started teaching dance and gymnastics. I was able to work with students with special needs, and I loved it. I really enjoyed the challenge of figuring out, okay, how can I help them reach this goal? Because it might look, their journey looks different than any other kid, just like every single kid's journey looks different. So in 2015, I went back to school. I got a graduate degree in special education. Graduated last December. Very grateful to say I'll be starting my first year as a special education teacher here in St. Louis this fall. So I do have that perspective of I want to live my life. I want to be safe and responsible, but I don't want to live in a bubble. What's been really wonderful is the relationship that Dr. Barrios and I have is I really do feel I can also be open and honest and say I want to work with children. I know that, I want to work in an environment where there might be germs and I might be exposed to things, but that's what I want to do. How do we make this work?
I respect the opinion of my social worker, dietitian, respiratory therapist, and I use their recommendation to help my patients.
It's great working with them. If you really have a team that you really get along with and really cares about people with CF, it's amazing.
Open-minded, willing to work with their patients. That's really what I feel like the CF clinics here in St. Louis have given to me as a kid and as an adult.
I've definitely had lots of issues with my gut, with my bowel. Lots of acid reflux. When I was growing up, my parents would have to take me to the ER because I'd be so stopped up. I'd be just, clutching on to things around the house, just screaming in pain. I'd be in so much pain. They'd take me to the ER. When I was 7, I went into the hospital because I was so backed up. I've had some repeat performances throughout my life.
John has been managing his lung disease and diabetes very well.
I do hypertonic saline, which is aerosol. I do Pulmozyme, which is aerosol. And then I do a vest treatment for 30 minutes. I do that twice a day. And then I have a slew of medications that I just take throughout the day.
Proud of John's approach to life.
I got really close to my doctors at Cardinal Glennon, Dr. Regent. Really he became my friend, my good buddy, he was the guy who you just look to have all the answers, and you really rely upon your doctors. They're the ones who are just making all of this work, and they're giving you hope, and they're giving you life, and they're making it so that you can navigate the waters of cystic fibrosis, and you can still go out and do all the things that you want to do as a kid. And then when I transitioned, again, Doctor and I being really close with him, we kind of started with a bang. I was having multiple issues at that time. Got to know him probably quicker than I wanted to because I kept seeing him a lot.
The CF Transition Clinic is at Cardinal Glennon Pediatric Clinic, where I'll go and I'll see patients usually who are older than 15 years old, and they'll start to see me. They'll be able to put a face to a name, get to know me because they've been with their pediatric doctor for their entire life. And it's a big thing to place your trust in a new physician. You go from someone that you know, the whole care team that you know, to completely changing care teams.
Dr. Nayak and Dr. Barrios are both great to work with. Come into pulmonary because of the cystic fibrosis specifically. So these are two pulmonologists who are heavily interested in cystic fibrosis. From a professional standpoint, we often have engaging conversations like that. And then from a personal standpoint too, it's really nice to be able to have that personal connection to hand off a patient to their adult provider, know that they're going to be well taken care of when they leave Cardinal Glen.
It was just a safety blanket, always that reassurance. Now that Dr. Christopher Barrios has kind of taken over my care, again, he's just a guy that you can go to and you can talk to, and he listens.
It's very important to me because I want them to continue to feel like the care that they've been getting their entire life, they continue to get. That it really hasn't changed just because they're an adult and they move care centers, that I still care for them and not just their lungs, but also the rest of them.
It has been very successful, and I am proud to say that we have made transition of many of our patients seamless and very smooth.
Parents said when I came home from the hospital, I just wasn't digesting any food, I wasn't going to the restroom, anything that is natural for a newborn just wasn't happening. So they took me to the hospital and found out that my intestines were blocked completely. And so they had to do a surgery to alleviate that pressure, and that's how they found out that I had cystic fibrosis. It kind of put a lot of pressure on them to understand the disease, understand what it meant going forward. And I'm thankful for them because they heard what the doctor said, and it was scary and it was tough, but they went about it in a way that they let me define what it meant, and they pushed me to explore everything and not hold me back, and I think that's what put me where I am now, so I'm thankful for that.
So Daniel is probably fitter than I am. Obviously he has cystic fibrosis, so he recently completed a triathlon in May, so just ridiculously athletic, very in shape, loves to push himself, has not really let CF as a lung disease define him at all. He really does things that you wouldn't expect from someone with a lung disease, and I think he's better for it, honestly. His exercise really does help people with CF.
Now I'm 28, almost 29 years old. I feel very healthy. My PT scans and everything have been really clean and really good over the last 28 years.
In 1980s, the people with cystic fibrosis would live for 20 years or so, the median age. When I started cystic fibrosis in early 2000, the median age was 39 years. Now it's 47 years.
And then fast forward to 2019, around October 2019, came the creation of Trikafta, which has been enormous for people with CF. It's been extraordinary. The improvements that we've seen in their lung function, in their reduction in their flare-ups or exacerbations, improvement in body mass index, improvement in quality of life has been enormous.
And the new word for Trikafta is highly effective CFTR modulator. I repeat, highly effective CFTR modulator. And what has happened, many of our patients are coughing less. They have regained the lung function. Patients who would have required lung transplantation, they have come out of the list for lung transplantation. It has given a new lease of life to the CF patients. You can actually use the expression, it's a breath of fresh air, because they can take deep breath now.
I remember when I was a kid being in the car with my dad, and he just told me that, he was just like, I promise you that someday we'll see this. And I never forgot that. I remember exactly where I was when he said that. And little did I know it would happen in my lifetime, and little did I know it would happen before I was 30 years old. And I didn't think it would be only 3 pills a day after all the pills that we've taken over the course of however long. But 3 pills a day, and how life-changing they are, it's amazing.
We went from having people in the hospital usually all the time. We would have someone, a handful of people admitted to the hospital at any given time for treatment of an exacerbation, to having almost none. And it really couldn't have come at a better time because it happened right before COVID.
One of the greatest things I've ever had my doctor stare me in the face and say, is he said, John, you need to start worrying about other things, like old people diseases, like heart disease. Like, he said those words to me, and I was just like, really? We're there, where I actually have to worry about these other diseases. It was awesome to hear, like, yeah, okay, I need to, working out and eating healthy and eating right. I need to start doing those things because I'm going to be around long enough to develop those problems.
It's due to the contribution of Cystic Fibrosis Foundation, and their goal is to get it done. Their motto says, get it done, means we have to cure cystic fibrosis.
So the new medicine is a new chapter in the story. So previous to that was stick to the routine. You never know what's going to come. Live your life fully, because you just don't know what's going to happen. And that's still the same, but the story has changed because all of those years of effort on the foundation side with Tony Regent and Robbie Nyack and myself and my parents, it paid off. So yes, we must be eternally hopeful, but there can actually be a miracle payoff to all of that hard work and ingenuity. Like, the foundation was really ingenious in their approach to raising money. And it took a while, years and years, but there's like this miracle payoff.
It's unbelievable. Like, I mean, I considered myself a pretty healthy individual to begin with, but the Trikafta has just brought it to another level. I mean, I'm actually gaining weight now, which has been very surprising. I went to the doctor, I think probably back in April. I stepped on the scale and I was like, I need to lose a few lbs. Oh my goodness, like, I can't believe how much weight I've gained.
I stopped coughing on January 9th of 2020. He knew it. He knew it was possible. He saw all the studies and the data. But to have a patient tell you firsthand that this lifelong cough is cleared up, we had a great moment together.
Even as a kid, I'd hear about other diseases, like, oh, I just take a pill and, it's gone. And the time that you spend on your treatments when you want to be doing other things, there was always this, like, what if one day I could take a pill and it would fix things? So, and I think it's been like that it feels like that for a lot of the CF population. And so the amazing, amazing research and work that the CF Foundation has done, but thankfully the Trikafta has really worked for me. It's really kept my pulmonary function at a above average level. Some women are now able to have children because of the shift that this medication makes. So it's changing lives.
My mom just loves it. And when I go tell her what I'm up to, she just can't believe, one, that I'm 51 and able to ride my bicycle 5,000 miles in a year at a pretty respectable pace, and have this long marriage, and I don't cough anymore. Like, that blows her mind when I told her that I'm overweight and I have to go on a diet, right? Because I was diagnosed, I was malnourished, I was dying of malnutrition. And to be a little bit overweight is just mind-blowing to her. So she loves it. And my dad passed away before this all happened, and I just wish I could share it with him. Yeah. He got to see the first generation of the drug, but I couldn't take that. So he had all of that reward, and he saw me do all that running. So we had plenty, but he would have took particular pride in seeing my life change. 20-year reversal of the disease in my body.
I'm in I remember telling my wife, I think it was after like the first several weeks of taking, I was like, oh my gosh, I feel fairly normal.
So I mentioned earlier that for someone that was born in 2019, they can expect to live to 48 years, but it doesn't take into account the improvement that we'll see from the CFTR modulators. So we really don't know, but if these modulators, these medications can be administered earlier in life, before the lung disease really sets in, before the diabetes really happens, before they pick up certain organisms that may make their life expectancy shorter, then we're really hopeful that they can have a really long life.
We have an amazing group of people at SLU to work with, and we always work for greater good and higher purpose, and we are always friendly. We help each other out at the time of crisis, and that's why it feels like a family. And I would like to thank SLUCare, School of Medicine, and St. Louis University for everything.
It's a great team of doctors that are all working together to provide me the best care.
I can say that at SLUCare, as someone who throws questions at them and kind of goes my own path a little bit sometimes, they've been very supportive, and also kind of say, okay, Chelsea, let's kind of put the brakes on and think about this. But they're willing to let you think about it rather than it feeling like a demand.
Have someone who can be in there with you in an understanding partnership way has really made a difference. I don't dread going down there. And when you need to go see the doctor 4 times a year, it's good to not dread seeing that person, right? Because I would have to get my energy up, like get pumped up for the visit. Okay, it'll be okay, it'll be okay. Then afterward, after you got the bad news, you're trying to keep your spirits up because you still gotta work, you got a family to take care of, you got their spirits to take care of, it's a lot. So to have someone like Robbie and Gwen in with you, it makes an incredible difference.
We have our own site here and our own center here, but we're part of something much bigger.
Some of my friends who trained with me or who were my colleagues as faculty had left St. Louis University, but they always remember St. Louis University fondly, and some of them do come back to work at St. Louis University. So this cannot be valued in terms of money or fame or something. There is something about SLU that is always attractive and makes you feel that you are at home and you're part of a St. Louis University family.